Hi, everyone. So excited to be here for this month's Care Connection. Very excited to have with us today two speakers from the New York Statewide Senior Action Council, Inc. First, we have with us Maria Alvarez, who's the Executive Director. She's worked with the Senior Citizens Group as an organizer, an advocate, and Director of Housing and Caregivers Program for over 22 years. And we also have with us today Eric Hausman, who is a independent consultant who specializes in Medicare and education and training. So I'm very excited to have them here with us today to speak to you all about the changes for New York, so to be prepared. Just so you know, currently you guys are all muted right now, but there is a question box on the side. So throughout the presentation, if you have questions, you can type them in, and we'll get towards that towards the end. And then we'll also be able to share some resources with you all to stay connected should you have further questions afterwards. So without further ado, I'll let Maria take it away.
Well, thank you so much. And I wanted to thank you for inviting us to speak today. My name is Maria Alvarez. I'm the Executive Director of New York Statewide Senior Action Council. We are a nonprofit. How do I advance? Oh, I see. We are a grassroots nonprofit organization, and that we've been serving the community since 1972. We have chapters throughout the state, and our organization is governed and directed by consumers, by seniors and advocates for seniors on a grassroots level. So we have organizations and people who are ardent supporters of senior rights and caregiver rights as well, and also for the entire community. So we have some programs. We have our Patients' Rights Helpline, which is a toll-free number, the 800-333-4374, and it's a toll-free number to assist hospitalized and institutional patients and their families with their patients' rights. So anybody who has a question about their rights in an institution or that one of their loved ones can feel free to call us, and we can help with any type of information or advocacy. And then we also have the Managed Care Counseling and Assistance Program, which informs, educates, and assists seniors and their families to make the best and most informed decisions regarding healthcare in New York State. So for example, the annual enrollment period, when people select what kind of healthcare or prescription drugs they would they would like to have. If they need information, sometimes it can be daunting. We assist with those decisions. And we also, and throughout the year as well. But just to let everybody know that our organization provides, all of our counselors are certified HICAP counselors that also provide free and unbiased information. So that means that we're not here to sell you anything. We're not here to, we don't charge for anything. All we want is to give you the best information so that you can make the most educated decisions regarding you or your loved one's healthcare needs. So in our Patients' Rights Program, we have our toll-free number. We do consultation to helpline callers on appealing discharges or complaining to the Center for Medicaid Services, Medicare Services, or New York State DOH. We monitor the trends in patients' rights to help suggest policy and program changes to improve the systems. And we advocate for consumer education so that people have a better idea of how all of these policies affect them, as well as how best to provide, to get help and assert their rights. We have a toolkit which is available for free. It's online, but if you can't print it out and you would like hard copies, we can always send them to you. It has a number of brochures. These are all the brochures that you see here on different issues. They're very good, overviews of all of these things, and we can certainly, help with more detailed information. But it's things like you know, against Medicare fraud, observation status, the roles and responsibilities of an effective healthcare agent, funeral rights, Medicare records or medical records, all of these things that people sometimes you haven't thought of it until you have the need. Sometimes it's good to have these things in advance before you need them. So we have these as resources. And also, if there are people here who are who work with different organizations and would like a presentation, we're certainly available to provide a presentation for your organizations at no cost. And then our third helpline is the New York Senior Medicare Patrol Program, SNP, which we are the federal grantee. It's a federal program in every single state and the territories. And what we do is we help people to empower and assist Medicare beneficiaries and their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So right now, of course, COVID has with COVID, healthcare fraud and fraud in general has exploded. So this program is very important at this time. So for those of you wondering, Medicare fraud is when people intentionally bill Medicare for services that were not received or billing for a service at a higher rate than is actually justified. There's a myriad of ways people can try to defraud Medicare. These are some of them, and these thieves are 5 steps ahead of the rest of us. So we're always finding what the latest fraud attempts are, and we alert the community. And we also, what we do is we report incidences and try to help resolve incidences with the Office of Inspector General in the United States, offices of law enforcement. Yeah, so again, billing for services, supplies, or equipment that were not provided, billing for excessive medical supplies, when people call and want to offer free services for the Medicare, for people's Medicare number, improper coding, unneeded or excessive x-rays and lab tests, claims for services that are not medically necessary, or using another person's Medicare number or letting someone else use your number. Those are all instances of Medicare fraud. So these are some of the tips that we always tell people, and these run through, any type of scam. Always treat your Medicare card like you would your credit card. Watch petty theft. Medicare would never doesn't call or visit you to sell you anything. They'll never reach out to you that way to call you. Many times people will call and say they're from Medicare. That it's not true. And be cautious of offers for free medical services, because when they say it's free service, what they're really doing is trying to get your Medicare information, and they'll use it for many other things. So don't ever, tell people not to ever give out your Medicare number except to your doctor or other Medicare provider that not just any Medicare provider, but the people that you work with. Don't carry your Medicare card unless you need it, because the truth is, even when you go to your doctor's office or another doctor's office that has been prescribed by your general practitioner, they already have all of your information. We're in the era of electronic health systems, so chances are they already have your information. Don't click on links from sources that you don't know, because that could lead to a lot of other scams and phishing and things. This personal healthcare journal, we offer this for free. So if you would like one, you could always call us and at our 800 number, and we are happy to give them out. For those of you who would like a presentation on any of these subjects, we we will provide all of these resources so for the participants, so we could send you resources if you needed them. But the way to use this personal healthcare journal, it's almost like reconciling your checkbook every month. I don't know how many people still do that, but you review your Medicare summary notices or your EOB, your other statements for services, and then you see if you received the services, if there's been double billing, services not ordered by your doctor, because every time you go to the doctor or do anything, you can write in your personal healthcare journal what happened and the date and what exactly occurred, and then you compare it against your summary notice, and you could and then you'll know if there has been fraud or not. You could also access your Medicare information at mymedicare.gov, and then you wouldn't have to wait for 3 months, because those Medicare statement notices, summary notices, are sent to you every 3 months. However, if you go to mymedicare.gov and create an account, you would be able to access that information much sooner. So you should always report suspect Medicare fraud and abuse by calling the provider, right, and gather the information and the documentation, and then call us. This is a free and confidential service. Again, we do not charge for our services, and we're not selling you anything. We are just here to help you because we receive government grants. That is our mandate, right? So you could always call us at 800-333-4374, and you'll receive, we'll be able, we have, oh, and the other thing is that our counselors, in addition to being certified, they're in person. So if you call us during business hours, Monday through Friday, chances are you will receive, you'll be, a live person will answer to help you, or if not, you could leave a message and somebody will call you back. Just wanted to give you a little bit about the COVID-19 update on scams while we're here. Just so that you understand, Medicare will cover the FDA-approved COVID-19 vaccines. Pharmaceutical manufacturers are now working to distribute the vaccine to federally and state-approved locations to start the vaccination of priority groups. State governments will handle the distribution, and anybody in New York State knows how that's happening, right? With the vaccinefinder.org and the state DOH, and in your local communities, the best thing also is to call 211 or the Office for the Aging, and they might be able to help you. Look for updates from local state leaders, and learn more about New York's vaccine rollout at covid19vaccine.healthnewyork.gov. I wanted to let you know there's this brand new scam that just came out, and if you've received this, just know that it's a scam. Pfizer is sending out this survey, and it's not really Pfizer sending it out. They say they're from Pfizer, saying that they wanted to get your impression about, the vaccine and what you're, they're asking you a bunch of questions. One of our partners in Montana brought this to everybody's attention. And then we reached out to Pfizer to find out if they had put out that survey. And they put out a notice saying specifically and categorically that Pfizer would never put out any type of survey or announcement to the public. So if you received any of that, you could always call us so that we're aware of it, but don't answer anything, don't click on it, don't call any numbers, so that you know. And that's brand new. It just came out, it just came out in the last week. Having said that, while many New Yorkers await a COVID vaccine, scammers are acting quickly to get your personal information. So one of that Pfizer survey is one example. So you should only get a vaccine from a trusted source. I would say your doctor should, for your doctor, and then or if you go through the vaccinefinder.org, that it's legitimate. Don't click on social media posts, texts, or email links selling cures. No, there is no cure, obviously, but also the CMS will pay for, and it's free actually, for the vaccine is free for anybody. And the other thing is, okay, so nobody will call you about the vaccine or ask you for your social security number, bank account, or credit card number. I have heard of people who, you know, are going to certain sites and they're being asked for their social security number, or, you know, that is not true. And also your immigration status does not come into play here either. People who, you know, you don't have to be a citizen, you just have to fall under the categories that are delimited by the government right now to be able to qualify to get a vaccine. And for those of you who don't know, just yesterday they brought down the limit to 60 years old. So people 60 and over will be able to get it starting March 17th. So they brought it down from 65 to 60, which is good. And you cannot pay to put your name on a list or pay to get early access to a vaccine. If anybody offers you any of these things, it's a fraud. And please call us and let us know. In terms of contact tracing, 5 things to know, right? Those contact tracers are the people that the state health department might call you if you've been exposed to somebody who did test positive. Here are 5 things you should know to spot the scam. Number 1, real contact tracers won't ask you for money. They're not there to ask you for money. Contact tracing does not require your bank account or credit card number. Do not click on a link in a text or email. You might download malware onto your device, and that gives the scammers open season on your phone and all your contacts and everything and accounts. Your immigration status doesn't matter for contact tracing, so real tracers will not ask. Contact tracers won't ask for your social security number, so just please keep that in mind always. Telehealth and exposure to fraud. Ways to protect yourself from telehealth fraud. Be sure to call your provider to schedule your telehealth appointment. If you receive a phone call from someone offering you free testing, so that could be your pharmacy also, or the vaccinefinder.org, treatment or supplies, hang up. It's a scam. So if somebody calls you up saying, do you want a you know, a free test or a back brace or anything like that, hang up. Guard your Medicare card. Do not give out your Medicare number to anyone other than your doctor or healthcare provider. Review your Medicare summary notice and explanation of benefits, and for improper billing and items that appear that you didn't order to receive, and write down your telehealth, and write down your telehealth, boy, this is very sensitive, appointments in your personal healthcare journal. That's basically what we've covered up to now. What does Medicare cover in relation to COVID-19? Medicare Part B covers COVID-19 tests when ordered by your doctor or healthcare provider on or after February 4th, 2020. Medicare covers all medically necessary hospitalizations, including extra days in the hospital for patients who had to stay longer under COVID-19 quarantine. Medicare will cover the FDA-approved vaccines funded through the CARES Act. Medicare also recently expanded coverage of telehealth services to enable beneficiaries to access a wider range of services from their providers without having to travel to a facility, including doctors, nurse practitioners, clinical psychologists, licensed clinical social workers. And during this emergency, there are also more options for the ways your providers can talk with you under this provision. So if you have any questions, please give us a call. We're also always looking for volunteers. So anybody who is interested in helping out spread information and in their communities, we ask that you call us and we can talk to you more about it. We have a core of volunteers throughout the state that does this, and we have a lot of resources that we give out. So please call us at 800-333-4374, and we'll be able to help you. And this is the same number that I've been saying this whole time. For any of our services, you call that number and we'll be able to help you from any point in the state. Oops. Okay, so thank you very much. I wanted to thank everybody, and I will be here for any questions, and I will turn it back over to Kara. Oh, before we do that, there's another thing I would like to do, because I wanted to make an announcement. I'm gonna stop showing the screen. Okay, I wanted to let you know that we will have, we also have 2 activities that are coming up as part of our teach-in, our Medicare, our patients' rights teach-in. One is that the Attorney General will be joining us on March 27th. Letitia James will be joining us, and also on March 24th. And if you'd like, you can always call us at 800-333-4374, because we're going to have a conversation, and you can also ask questions and register for the event. So thank you so much.
Thank you, Maria. I'm going to start with the Medicare presentation then. My name is Eric Hausman, and I'm a consultant specializing in Medicare education and training, and I'm contracted with New York Statewide Senior Action Council, who's sponsoring my presentation for today. And I'll tell you what we're going to cover. So I want to talk today about enrollment in Medicare. We'll talk about cost sharing, what people with Medicare are responsible to pay for. And then I want to talk about choices in Medicare. And for people with Medicare, they really have a lot of choices as to how to get the Medicare coverage. But basically, it all boils down to 2 choices. Everyone with Medicare can either be on original traditional Medicare, or they can be on a Medicare Advantage plan. It's one or the other. Now, for those that choose regular traditional Medicare, you'll hear about big gaps in coverage, deductibles and co-insurance. So how do people fill in those gaps? Well, some people have retiree health insurance from a former employer that might do that. Other people that have very limited income and resources might have Medicaid, which can help with that. But most people today don't have retiree coverage and don't qualify for Medicaid. And they might consider purchasing a private Medigap, a Medicare Supplement plan. You've probably seen them advertised from AARP on the TV. That's one way to get your Medicare. Original, traditional Medicare, with or without a Medigap plan. The other way is to join a Medicare Advantage plan. And those are private plans that are contracted with the government to provide all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that take that plan. And whichever way you decide to go, whether it's original Medicare or a Medicare Advantage plan, you can have Medicare Part D, that's the drug coverage. If you're in a Medicare Advantage plan, in most cases, Part D will be included. If you're in original Medicare, you could purchase a separate drug plan. And then I'll talk about the Medicare Savings Programs, which help people with limited income to pay their Medicare Part B premium. Now, whenever I talk to people that are new to Medicare, my first question to them is always, are you collecting Social Security? Because I know if somebody's collecting Social Security prior to becoming Medicare eligible at age 65, they're automatically enrolled in Part A and Part B. But if instead you're collecting Social Security after 65, you're not automatically enrolled. And it's up to you to enroll during one of the Medicare enrollment periods. So let's start with the initial enrollment period. This is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. The 3 months prior to the month they turn 65, the month of, and the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Part B starts the first of the month you turn 65. If you enroll the month you turn 65, Part B starts the first of the following month. But if you enroll in those last 3 months, your Part B will be delayed. So if you enroll the month after the month you turn 65, Part B starts 2 months later. And if you enroll 2 or 3 months after the month you turn 65, Part B will not start until 3 months later. Now, for the people that are still working at 65 or covered under a spouse who's still working, especially if they're working for a large employer where the employer insurance would be primary, those individuals many times will take Medicare Part A of Medicare because there's no premium. We'll talk about the premiums next. But they'll delay enrollment to Medicare Part B. Why? To save the monthly Medicare Part B premium. If that's the case, and you are covered at 65 under your own or your spouse's active current employment, not retiree plan, not COBRA, but active current employment, you can delay enrollment in Part B and then sign up later without penalty using the special enrollment period. So again, the special enrollment period for people that are still covered through active employment allows you to sign up for Part B while you're working or within 8 full months following the month you're no longer covered through active employment. Okay? But these are the only people that are able to delay enrollment in Part B without penalty. Again, the people that are covered at 65 under their own or their spouse's active current employment. If come 65, you're retired and not covered under a spouse who's still working, you probably want to enroll in Medicare Part B when you're first eligible. Because for the people that miss the initial enrollment period and who don't qualify or maybe miss their special enrollment period and then realize sometimes years later that they need Medicare Part B, they make them wait till an annual period. It's called the general enrollment period. It's every year during this time, January through March, in which your Part B doesn't start right away. It starts July 1st. And these are the people that are subject to a late enrollment penalty. The late enrollment penalty is 10% of that year's standard premium, 10% for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty is not one-time penalty. It is a lifetime penalty. So people need to be very cautious with their decision about if and when to enroll in Medicare Part B. Now, once you do enroll in Medicare Part B, there's a monthly premium involved. Okay? So Medicare Part A, the hospital insurance, most everybody gets that for free, for no premium. But Medicare Part B, people pay for. So this year, the standard Medicare Part B premium is $148.50 a month. But for some people, they actually pay a higher premium because they have a higher income. And we're talking about people whose incomes are above $88,000 for a single, above $176,000 for a married couple. The way they determine this, Social Security, they get together with the IRS. The IRS will provide your most recent tax return. For most everyone, they're looking at your tax return from 2 years prior. So for 2021, they were basing it on your 2019 return. And if your what they call modified adjusted gross income from 2019 was above this threshold, you would pay, you're paying today a higher Medicare Part B premium as a result. Now, the good news is if you're paying a higher premium 1 year based on income, it doesn't necessarily mean that you will forever, because every year they'll automatically reassess this. For 2022, they're going to look at your 2020 return. And if your income goes below the threshold, whatever the threshold is that year, you'll go back to paying the standard Part B premium for that year. Because a lot of times people we see that pay that high premium, they're not really people that have high incomes in retirement. But what happened was when they look back 2 years ago, their situation was different. They were still working 2 years ago, or their spouse was still working. Well, if you have what Social Security calls a life-changing event, a change in your marital status, more likely a change in your work status, you may be able to successfully appeal that higher Part B premium. So for instance, if you and your spouse worked in 2019, your income was high, you might be paying a higher premium today. But if in 2020 you lost your job or your spouse lost their job and their income went down, I would then contact Social Security now and tell them I had a life-changing event, a change in work they recognize. And instead of basing my premium on 2 years ago, like you do by default, I want you to base it on the more recent 2020 tax year. And as a result, people can save. So you can see from this chart, sometimes significantly on their Part B premium. And then I'll point your attention to the third column in this chart, which talks about Medicare Part D, which we'll cover later. So anybody that pays an additional surcharge for their Part B premium based on their income, also, if they have Part D, has to pay an additional surcharge for that as well. And it's paid the same way as their Part B premium. If you're collecting Social Security, taken out of your check. If not, billed to you directly. Now, besides the premium for Part B, there's an annual deductible. This year, it's $203. So that means the first $203 in covered medical expenses, that's your responsibility, unless you have other insurance to pay it. Once you meet the deductible, Medicare pays 80% of what they allow. You're responsible for the other 20%, the Medicare coinsurance. It's different, though, for lab tests and for most preventive services, including the flu and the new COVID-19 vaccine. These are covered at 100% by Medicare, not subject to the Medicare Part B deductible and or 20% coinsurance. And then that's Medicare Part B, but it's really different from Medicare Part A for hospitalization. Now, although most everybody gets Part A for free, for no premium, there's a large deductible if you're admitted to the hospital. So this year, the hospital admission for up to 60 days, okay, you're responsible for a deductible. It's $1,484. If you're in the hospital beyond 60 days, for the 61st or the 90th day in the hospital, you're responsible for a daily copayment this year, $371. That's per day for days 61 through 90 in the hospital. If you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For these 60 lifetime reserve days, you're responsible for a daily copayment, $742. That's per day for those 60 days. If you're discharged from the hospital to a skilled nursing facility for rehab care, Medicare pays the first 20 days there in full. The next 80 days, you're responsible for a daily copayment. This year, $185.50, and again, that's per day for days 21 through 100 in a skilled nursing facility. Now, these Part A benefits, they're not a calendar year benefit like Medicare Part B. Part B is fairly simple. You know, you got one deductible, $203 this year. Once you've met it, that's it. You're done for the year. But the Part A deductible, somebody may have to meet that more than once in the same calendar year because it's once per what they call a benefit period. And a benefit period begins the very first day you're admitted to the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of at least 60 consecutive days, at which point your benefits renew, they start again. So for instance, if you had to be admitted to the hospital tomorrow for 5 days, Medicare would pay everything except that deductible, $1,484. But if in the next month you had to be readmitted to the hospital or a different hospital, same condition, different condition, doesn't matter. Less than 60 days have gone by since your discharge, you're still in the same benefit period. You just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. But if instead of being readmitted the next month, you could be readmitted 3, 4, 5 months later, still the same calendar year, but now it's a new benefit period. More than 60 days have gone by since your discharge. Your benefits renew, they start again. You're back to day number 1 of your first 60 days of coverage, and you have to meet a new deductible. So I hope this will help to point out the importance of people having other insurance besides Medicare. Okay? And that's where we get into Medigap insurance. But before I mention the Medigap, I'll just mention here some of the services that Medicare that are common that Medicare does not cover. Medicare does not provide coverage for dental care, for routine vision care, including eyeglasses. They do not cover for hearing aids. They do not cover long-term care. They cover short-term rehab care that you saw on the last slide, but not long-term care. And Medicare does not cover a comprehensive annual routine physical exam. They cover a more limited wellness visit, but not the head-to-toe physical exam. And they do not cover any services outside of the United States and its territories, like Puerto Rico. So the Medigap insurance. So far today, I've been talking about original traditional Medicare, Part A hospital, Part B medical. And I spoke about the gaps in coverage, deductible, coinsurance. Now I want to talk about filling in the gaps. For the people that do not have retiree health insurance and do not have Medicaid, they might consider purchasing a private Medigap, a Medicare Supplement plan. There are 10 standard plans that are available for sale today, plan letters A through N, and they all cover certain things. They all cover days 61 through 90 in the hospital, that $371 per day. They all cover the 60 lifetime reserve days, the $742 per day. Plus, if you exhaust your Part A benefits, they'll all provide up to an additional 365 days of inpatient care. Most plans pay the $1,484 Part A deductible. Most plans pay the entire 20% Part B coinsurance, and then other benefits vary from plan to plan. But let me tell you the two most important things to know about Medigap insurance. One is that the benefits are standard. So different companies sell these plans, and they charge different amounts, but as long as it's the same letter plan, doesn't matter how much they're charging. It's exactly the same coverage. So it's well worth your while to shop around for the best deal on the Medigap plan letter of your choice. The other thing to know, in New York State, unlike most states, we have continuous open enrollment for Medigap. And that means as long as you have Part A and Part B, it doesn't matter if you're over 65 or you're disabled with Medicare under 65, you could purchase a Medigap plan anytime at all. They cannot deny you Medigap insurance in New York State. Not only that, if you have a Medigap plan already and you live in New York State, you can switch your Medigap plan from one insurer to another at any time. But what you may run into is a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So what that means is, although they'll sell you a plan at any time, they may not cover a service related to a pre-existing medical condition for up to that first 6 months. However, most people are able to avoid the waiting period because they've had some sort of prior creditable coverage. And most everything counts for creditable coverage. It could be another Medigap plan. It could be a Medicare Advantage plan I'll talk about next, employer plan, retiree plan, COBRA, VA for veterans. As long as there's no break in coverage or a short break of less than 63 days from when that ends and the Medigap plan begins, they credit the time again with the prior coverage towards meeting the waiting period. And I included a link here to the New York State Department of Financial Services so you can get a complete listing of all the Medigap insurers, the plans they sell, their waiting periods, and very important, their current rates or premiums. And then I want to tell you about something that changed. Here's a list of all the Medigap plans, the chart. And I'll point your attention to two Medigap plans that cover the Part B deductible. Those are plan letter C and plan letter F. What they did last year, starting last year, for people that are newly eligible for Medicare. So for instance, somebody that turned 65 last year or is turning 65 this year or in the future, they cannot buy a plan that covers the Part B deductible, meaning they cannot purchase Plan C or Plan F. They can get D or G, which is the same plan, it just doesn't cover the deductible, but they cannot buy the most comprehensive plans. However, if you were somebody that was eligible for Medicare prior to 2020, even if you didn't enroll because maybe you were still working or your spouse was still working, covering you, you can get, when you finally get Part B in the future, you can get C or F. Okay, you don't need to be enrolled prior to last year. You just need to be eligible prior to last year. But again, if you're becoming 65 this year, or you became 65 last year, you cannot purchase the most comprehensive Medigap plans, plan letter C and plan letter F. So far I spoke today about one way to get your Medicare, original traditional Medicare, and that might come along with the Medigap plan. This is the other way to get your Medicare, to join a Medicare Advantage plan, which we said earlier were private plans that were contracted to provide all of a person's Medicare benefits through a network of providers. Most everybody's eligible to join. You just have to have Part A and Part B, and you need to live in the service area of the plan. That's it. But unlike Medigap insurance, where you can switch from one insurer to another, if you live in New York State or purchase a plan at any time, for Medicare Advantage, for most people, there's only certain times they're able to switch. So first of all, you can enroll in a Medicare Advantage plan when you're first eligible and enrolled in Part A and Part B. If you don't, or maybe you did, but now you don't like the plan, you want to switch, most people have to wait till the annual election period. That's every year from October 15th to December 7th. If you sign up for a plan during that time, your new plan starts January 1st. If you discover the beginning of the year that was a mistake, There's another enrollment period going on right now. It's called the open enrollment period. Every year from January through March, anybody that's on a Medicare Advantage plan has one additional opportunity to either switch to another Advantage plan or original Medicare, one time, January to March, to be effective the first of the following month. Now, it's important if you join a Medicare Advantage plan to realize you're not giving up your Medicare benefits. These private plans are required to cover whatever Medicare covers, plus, as an incentive to join, they will cover to a limited extent some services Medicare does not pay for. So, for instance, they may provide limited coverage towards things like dental, towards vision, towards a hearing aid. They probably pay for that routine physical that Medicare doesn't. Maybe they pay for a gym membership for you. All things not covered by Medicare. But what I think is the biggest incentive, especially in the New York City area, is that the plan may be available for as low as no premium. You may have seen them advertise, 0 premium. You're still going to pay that Part B premium, $148.50 or whatever you're paying for Part B. They're saying 0 additional premium, plus they include the Part D drug coverage, no premium, some of them. So that could be a very powerful incentive for somebody that maybe doesn't have retiree health insurance, doesn't have Medicaid, cannot afford or doesn't want to pay $200 or more a month for the typical Medigap plan. You may be very interested or tempted to join a 0 premium Medicare Advantage plan instead. But even if the plan has no premium, that doesn't mean the plan has no cost for you. It's going to cost you on the other end when you access care, usually in the form of a copayment. So some plans have no copayments for the primary doctor, but they all do for specialists, some as high as $50. If you need to be admitted to the hospital, you might have a daily copayment up to a maximum number of days. For things like x-rays, for mental health, for physical therapy, copayment or co-insurance, a percentage that you're responsible for most services under most plans. But in fairness to the plans, it's not an unlimited amount that you're responsible for. All the Medicare Advantage plans have a maximum out-of-pocket limit, which this year cannot exceed $675.50 in network. Okay? So what that means is, although you have copayment or co-insurance, when you access care, it's applied towards that out-of-pocket limit. And if you reach the out-of-pocket limit for the year, 100% coverage for the remainder of the year for all Part A and Part B, for all hospital and medical covered services under the plan. $75.50 is the highest limit any plan can have, and many plans do. But there are also plans that have lower out-of-pocket limits. And you may want to look at that when you're comparing between your Medicare Advantage plan choices. Now, whichever way you decide to go, whether it's original Medicare or Medicare Advantage, you're entitled to Medicare Part D. If you're in a Medicare Advantage plan, an HMO plan or a PPO plan, Part D will be included with that plan. Okay, because when you join a Medicare Advantage plan, you get all your Medicare benefits, Part A hospital, Part B medical, Part D drug, all from the same plan. If instead you choose original traditional Medicare with or without a Medigap plan, you could purchase a separate standalone drug plan. If you live in New York State, there are 28 different drug plans to choose from. These 28 plans each have their own formulary, their own list of covered drugs. So not every one of those plans necessarily covers all your drugs. And they got their own network of participating pharmacies. So the pharmacy that you like, maybe they don't take all 28 plans. So how do you compare? You have so many choices. You have to go to the Medicare website, medicare.gov, or have somebody go there for you, enter your drugs and your pharmacy, that in their search tool, it will compare all the available plans and rank them based on your individual needs, from least expensive to most expensive. So let's talk about the costs with Medicare Part D. First of all, these 28 plans each have a premium. There's one plan that's less than $8 a month this year, but other plans are $40, $50, $60 or more dollars. It varies. Besides, the premium plans can have a deductible. This year it could be as high as $445. Many plans have a $445 deductible. Some have a lower deductible. And then when you reach $41.30 in total drug costs for the year, you get to what they call the coverage gap, or the donut hole. So again, that begins at the point that you reach $4,130 in total drug costs. Regardless of how much you paid out of pocket up to that point, that doesn't matter. When your costs get to $41.30, now you're in the coverage gap. And at that point, you pay 25% of the cost of the drugs out of pocket, until for people with very high cost, they may reach what they call catastrophic coverage. Catastrophic coverage begins this year at the point that they reach $65.50 in true out-of-pocket costs. Okay? What does that include? Everything you pay, not the premium, but everything you pay at the pharmacy. Deductible, copay, co-insurance, plus during the gap, there's one thing you don't pay, but luckily it counts towards the $65.50, and that is for brand name drugs, which can be very expensive, of course. You're paying 25% during that gap, but what you don't see is of the other 75%, 70% of that, most of that cost is a drug manufacturer rebate. Even though you don't pay it, that still counts towards the $65.50, and that's good for you because this way it'll get you out of the coverage gap and to the catastrophic coverage more quickly. And once you're in the catastrophic coverage, your drug costs go down where you're paying no more than 5% of the cost of the drug or a small copayment. That's how plans are structured. But in order for that to be really meaningful for you, you have to go to the website or go there, somebody go there for you to get an estimate of your costs. Not just once in your lifetime either, but every year in the fall when the information comes out for the following calendar year. Now, there are some people that get assistance with their drug costs. They call this extra help or the low income subsidy, LIS. Some people get it automatically. If you have Medicare and Medicaid or one of the Medicare Savings Programs where the state pays your Part B premium, then automatically you get full extra help, which means you can get a subsidy that'll pay your entire Part D plan premium and reduce your copayments to only small copayments at the pharmacy. If you don't have Medicaid and you don't have Medicare Savings Program, but you have limited income and limited resources, you won't get this assistance automatically, but you may be able to apply to get, if not the full subsidy, at least a partial subsidy. The place to apply to is Social Security, best done on their website, Social Security or SSA.gov. You need to have an income less than 150% of the federal poverty level. So what are we talking about? For a single person, not much more than about $1,600 a month, plus limited resources as well, about $14,000, $15,000 for a single. If your income and resources are above those amounts, you will not qualify for the subsidy and you'll pay the full premium, the full cost sharing under the plan that you choose. Now, we meet a lot of people that are making the transition from Medicaid through the marketplace and are becoming Medicare eligible now. Those people, like we said, like all people with Medicaid, automatically get full extra help, and they have to be in a Part D plan, which they'll be assigned to if they don't choose one, for their prescription drug coverage once they're Medicare eligible. For those that have drug coverage through a former employer or union, they should be getting a notice from the former employer or union if it's creditable drug coverage, meaning it's as good or better than Part D. And if it is, the notice probably says don't sign up for Part D, because if they did, they may lose the drug coverage through a former employer or union. And then for those in a Medicare Advantage plan, HMO or PPO plan, we said you get your Part D drug coverage through the plan. Veterans that have drug coverage through the VA, it's credible drug coverage. And veterans, although they may want to have a separate Part D plan to allow them to go to private pharmacies outside the VA, veterans that don't sign up for Part D, if they sign up during the next enrollment period, would not pay a penalty. And then EPIC. EPIC is New York State's Pharmaceutical Assistance Program. It's for New York State residents, 65 and over, that have incomes up to $75,000 for a single, $100,000 for a married couple. EPIC does not work on its own. EPIC only works as a supplement to your Part D plan, where your Part D plan is your primary, your main insurance. EPIC wraps around. EPIC helps to fill in the gaps in coverage. And what does EPIC cost? For most people, it's free. So to give you an idea, if you're a single person, you have an income between $20,000 and $75,000, like many people in New York State do, you would be in EPIC's deductible plan. EPIC would be free, but you'll have to meet a deductible on a sliding scale based on your income before EPIC will pay for your drugs. But for me, somebody that has Part D and they have an income $30,000, $40,000, $50,000, $60,000, I don't see any reason for them not to have EPIC. Because sometimes they say to me, well, I don't use a lot of drugs. How am I ever going to meet this deductible? It's $1,000. It's $2,000. But I would say, so what? You don't reach the deductible. It's free coverage. In the meantime, you have EPIC in place should your situation change. And let me tell you one more benefit of EPIC. Unlike most people who can only change their plans once a year during that annual period, EPIC members can change their Part D, which could mean Medicare Advantage plan with Part D, one additional time each year outside of the enrollment period. So for some people, it's worth it to join EPIC just to be able to change plans without having to wait till the next year. And if you're not an EPIC member already, you can sign up anytime. It's always open enrollment for EPIC. You can't apply online, cannot. You could have to do that through a paper application, which you would mail or fax to EPIC. And then lastly, today I'll talk about the Medicare Savings Program. But I want to bring your attention to that last one, the QI program. So these Medicare Savings Programs are for people with limited income, and they pay the monthly Part B premium for those that qualify and apply. In order to qualify, you need to have an income, you see there, $1,456 for a single, up to $1,960 a month for a couple. But a couple of advantages to living in New York State. New York State, they don't have an asset test. So like EPIC, whatever your money you have in the bank, not concerned about that. Only income to qualify. On top of that, even if your income's a little too high, you may still qualify. Because if you're paying for private health insurance, other health insurance, like let's say a Medigap premium or long-term care insurance premium, which could be expensive, or a cheap dental or vision policy, you can deduct those other premiums from your income to qualify for the Medicare Savings Program. And then the Medicare Savings Program not only pays that premium, that $148.50 a month, but it also makes you eligible automatically for full extra help with Part D, which means you can get a Part D plan for no premium and only small co-payments for your drugs. So let people know they can apply for this benefit at any time of the year. They may be eligible. They can apply regardless of whether they get their Medicare through original Medicare or a Medicare Advantage plan. So I know that was a lot of information in a short period of time. So I just wanted to let everyone know that there are resources. If you have questions, you can contact Maria, mentioned New York Statewide Senior Action Council earlier. Also in New York State, we have the HICAP program, HIICAP. You'll see our phone number on the back of the Medicare and You 2021 book, or anywhere in New York State. Okay. So let me pause here if there are any questions.
Yeah, so one of the questions we have is because I know this comes up at different parts of Medicare. The person didn't really say specifically which part, but they were just like, if you could explain premiums versus deductibles. They're still confused on how those go together and work together.
Sure. So a premium is an amount that you pay just to have the health insurance, just to have that coverage. Okay, regardless of whether you use it, you're paying that every month just to have the health insurance in place, whether it's the Part B as in boy premium for your medical insurance or the Part D as in drug premium. Okay, deductible is when you start having services. So when you start having services and claims come into Medicare, Medicare applies the first amounts that they allow each year towards a deductible before they start paying for the services. So deductible is maybe an annual amount that you're responsible for, as it is for, again, for Part B and for Part D, once you start accessing care.
Great. We had someone else, one just wanted to know about the slides. That's something that, Eric, you can forward to me. I can definitely share, with the people who are viewing with us today. We do have another person who has asked, and I don't know if you and Maria know this at all, because it applies to specifically Massachusetts, but does EPIC exist in other places other than New York, or is it just New York?
I can speak to that to some extent. So
Okay.
the federal name for the EPIC program is, the acronym is SPAP, State Pharmaceutical Assistance Program, SPAP. So EPIC is the SPAP specifically for New York. That's the name of our program here in New York. There are some other states, I can't say specifically for Massachusetts, but there are some other states that have their own SPAP plans that work not exactly like EPIC does, but you would have to find out from that. What I would do is, for somebody that lives in Massachusetts or any other state, I mentioned the HICAP program in New York, but that's actually part of a national program. Nationally, it's known as the SHIP, SHIP, State Health Assistance Program. So they have that in Massachusetts, in every state, where you can speak with the local counselor who would be much more familiar with that.
Okay, great. They had someone who's now saying they applied for Part B, because they were asked to submit employees' information. So in regard to this, if they're unable to provide a form, does this mean potentially that they would have penalty for life with this?
Sure.
That might be a little more specified.
I think I understand what they're talking about. They're
Yeah.
talking about enrolling in Medicare Part B medical insurance using the
Yeah.
special enrollment period that I mentioned at the beginning today for people that had delayed enrollment in Part B at 65 because they were still covered under their own or their spouse's active employment, I should say. Now, when that's ending, they're using the special enrollment period to get Part B later without having to wait or pay a penalty. But you need to prove to Social Security that you've been covered continuously since 65 under your own or your spouse's active employment. Also, there's a form that people can download from the Social Security or Medicare websites for the employer to complete. But sometimes, and that's usually what happens, the employer completes that and you submit that to Social Security and they know they can enroll you without penalty or having to wait. But for some people, they have a problem with that because maybe their former employer is no longer in business or they're out of contact. If that's the case, because of the pandemic, Social Security on their website is allowing enrollments online using the special enrollment period, where if you get the employer to fill out the form, they give you a list of documents that you may be able to submit in place of that, where it would prove to them that you were covered under active employment, such as a pay stubs, for instance, that show an employee contributions for health insurance. There's a list of things that they would accept.
Okay.
Again,
and I would say to this person, if they have like further questions, that's something that they're able to call and ask about, correct?
Sure, that's certainly something that we would counsel them about if they're in New York, or if not, the local counseling program if they're outside of New York. But that applies nationally anywhere.
Okay, great. All right, so it looks like that's all the questions we have currently, Eric, that I'm seeing. So if people have questions that they want to continue to ask, they can definitely get in contact with the New York State office or connect with the Office of Aging and through the hotline as well, correct?
Yes, absolutely. If you think of any questions later, or if you want to direct people to contact us.
Oh, yeah.
Definitely.
And I actually...
Oh, I'm sorry. I was going to mention the New York City Department for the Aging is also sponsoring biweekly Medicare orientation classes, where we offer a comprehensive overview of Medicare and related insurance. We intended for people new to Medicare, but it's open to the public. And you can find our classes on the Department for the Aging website, which is nyc.gov/aging, AGING. And then you can register, and they're free and open to the public. Excuse me.
And I do see we actually had one person like type in while we were wrapping up right there that asked, when initially applying, is this something you would recommend doing online, or should the person just go into an office to start this process?
Yeah, no, thank you for asking, because that's something that changed also because of the pandemic.
Yeah.
Currently, Social Security offices are closed. So unless it's in a really exceptional circumstance, you would not be able to go in person to Social Security. Instead, it's recommended, and it always has been recommended, that people apply online on the Social Security or SSA.gov website. And that's for the Medicare Part A and Part B as in boy enrollment we're talking about.
Okay, great. And then someone mentioned if the Social Security offices aren't being as responsive, due to the pandemic and not helpful, is there another avenue that they should be connecting with?
Well, the Social Security, what they're doing now is that because the offices are closed, they have a national number, but you could also go to the website, ssa.gov, and find the phone number for the local office. And then you're actually able to contact the local office directly, which is what we would recommend rather than the national number if you've had problems connecting at the national level, if you will.
Okay, great. All right, it looks like that's all that I'm getting right now for questions. So thank you, Eric and Maria, for being with us today here to discuss these matters with everyone.
Okay, thank you, Kara.
Thank you for having us.
Mm-hmm.
And if
again,
anybody has questions, they could always call us, you know, about enrolling or any questions about Medicare. They could also call our helplines at 800-333-4374.
Great. And then if you have those flyers, Maria, I can send those out to everyone about the upcoming events as well that you mentioned towards the beginning.
Thank you. I will send them to you right now.
Okay, great. I hope everyone has a safe day. And thank you again, Eric and Maria, for being with us.
Okay, thank you. It was a pleasure.
Thank you. Have a nice day.
All right.
Bye.
Take care.
Thank you.